success metrics would not have been more than 5 or 6 at the most.
Okay.
I think today it's inching towards 8. So
Okay.
7 or 8 is
So
what
what's
we would-
changed? What's gotten you from 5 to 6 to now about 8?
First and foremost, there's a general buy-in from
Yeah.
the beneficiaries of these kind of programs. That itself pushes up the indicator. And then, of course, you've got things like systematization of many of the things we're doing. And that certainly helped to push up the indicator.
So if we're talking about aggressive expansion, and now if you're already 8 as far as the success scale is concerned, what can we actually see happen with the ARY clinics, for instance? You have this great concept of creating health cities across India. You know, how does it all tie in, and where do you actually see the future?
The concept of health cities is finally come into being and been very well received. And I think what we want to do is to really then take advantage of these health cities and create these ARY clinics
Right.
in those areas. So that will be our first experiment to see how do we then partner with all these various large, hospitals. And then I think the bigger, impact is going to be felt only when the government basically enters into or engages into the setting up of a national health system. Because
But
all
have you tried
this,
to engage with the state
Yes.
government, for instance,
Not just
in
the
order to push the ARY clinics forward?
Actually, the state government already also has its own micro health insurance program. The Yashaswini program was actually introduced to cooperatives, and it used the network of government hospitals. The ARY scheme is about networking it with the private sector hospitals and including, the rural communities. So there's a different model, but it's more or less the same concept. And I think what we are now doing is to build all these models and finally help the government to develop, a universal healthcare system.
But have you seen a mindset change in the engagement or the interaction with the government, how they
Yes.
would approach you, maybe 5 years ago, and how they approach you today?
Healthcare and education is always a great plus for their political manifestos and political image. And you know that the health insurance scheme, Arogya Shri, which was introduced by the Andhra government,
Right.
has been, talked about and hailed as a huge success. So I think there is now a general buy-in that micro health insurance is the way to go. But then it should be much more deeply thought out from a national point of view.
Right.
In fact, I'm now trying to work with the Public Health Foundation of India to say how do we come up with a broad healthcare delivery system which is based on micro health insurance.
Helping Kiran achieve her vision is Rani Desai, who joined the Biocon Foundation in 2005. As the head of strategy and operations at the Biocon Foundation, Rani focuses on conceptualizing and implementing developmental programs. Her aim, like Kiran's, is to bring about social inclusion of economically weak communities, but this has its own challenges.
One of the challenges is finding good doctors to man our clinics. It's not easy to give doctors a career path, and so many of them don't want to come to rural areas, and this is the same challenge that the government faces. One way we are addressing this challenge is by bringing in young people, and we now have about 7 very young doctors who are between their graduation and their, starting their postgraduate programs, and we're finding them very committed, and they're developing a lot of work for us. I think the other challenges are making the healthcare accessible. Even though we are in pretty remote areas, it's difficult for people to come to our clinics, and we address those challenges by taking the healthcare to various remote places. So our teams go to these places.
What was very important was to also make sure that you don't just build a toilet for an individual household,
Right.
but to get them to be a part of the process.
Not just external, Kiran also believes in looking inwards to empower and enlighten. The support staff at Biocon, like housekeeping, gardening, maintenance, security and transport workers, have also been included in the Foundation's initiatives. With the help of Microsoft Research Labs, the Foundation has begun a digital literacy program called Khalsa Plus on all Biocon campuses. The aim is to increase computer literacy through free-to-use open-access internet-connected PCs. The effort is also to enhance their communication skills and increase self-confidence among staff members like Kalavati, who can now boast of her own personal email ID.
What have been the changes that you've actually brought about within the company that impact the lives of your employees?
We want all our employees to be very sensitized about the things we are doing for our communities. So for a long time, we've actually supported immunization programs. We've supported a lot of blood donation camps and things like that, where our employees have been very, very willing to support all this. Of course, we insure all our own employees and their families, and I think many of them are beneficiaries of the ARY scheme. Then, of course, we have a number of schools that we are supporting, and many of our employees are also now engaged in going and spending a little bit of time with the rural schools and trying to see if they can at least help with the educational process. We are one company that pays for the education, the school education of all its employees.
Okay.
And we also selectively start supporting college education depending on the economic situation of these employees. We are also engaged beyond just micro health insurance in health and sanitation programs.
According to the UN, 80% of rural India lacks access to basic and clean sanitation. To address this issue, the Biocon Foundation began its sanitation initiative in 2007. Building sanitized facilities for communities in the Hoskur region, like at the site of this over 100-year-old Madhurama temple, which attracts almost 40,000 pilgrims during the Holy Yatra. Lack of basic sanitary facilities and hygiene became a grave concern for the pilgrims who were falling ill. So, to provide relief, the Biocon Foundation built a community toilet block in association with the Bangalore Urban Zilla Panchayat and Hoskur's Gram Panchayat. In an effort to also encourage personal hygiene and sanitation, the foundation, along with the Embassy of Ireland and the Government of Karnataka, has helped the village community build individual household toilets. With the beneficiary household contributing just 1,000 rupees and the family members pitching in with labour, to date, close to 1,000 household toilets like these have been built.
I was finding it very interesting. I was looking at the cost structure, and it actually, when you think about it, it costs nothing to get this infrastructure up and running. It's what, about $50 that you actually require to sort of fund one community toilet? Is that correct?
The government was only giving something like 1,000 rupees, and whereas it actually costs between 7 to 10,000 rupees. And therefore, we decided to, make, sort of plug in the difference and build these toilets. And here I think, yes, the amount is very small if you were to look at it. But what was very important was to also make sure that you don't just build a toilet for an individual household, but to get them to be a part of the process.
Another initiative by the Biocon Foundation is working towards creating awareness about diabetes and related problems. The foundation has partially funded the mobile diabetic foot care and vascular diagnostic clinic like this one, which is managed by the Jain Institute of Vascular Sciences. Catering to patients from the lower economic strata, these mobile vans visit the ARY clinics once a month. Built on a bus, the clinic is completely equipped and staffed to evaluate and treat diabetic foot problems. Patients get free foot screening and advice on the illness and treatment. More than 100 patients can use this service at a time.
Biocon is very determined to show how we can actually deliver very affordable drugs. We are trying to do more for less, for more people.
Most Indians cannot afford to pay the high costs of high-end technology treatments. To address this concern, the Narayana Hrudayalaya, which was begun by renowned cardiac surgeon Dr. Devi Shetty and the Biocon Foundation, came together to make high-tech healthcare more affordable.